My name is Chuck Ramsey. I'm from Knoxville, Tennessee. I was raised there. Uh, I went to West High School and was an all-state quarterback at West High School, earned a scholarship to Wake Forest University, and was drafted into the NFL and played 8 years with the New York Jets. The way that I got involved with Beamer is my friend Jim Vesper called me one day and said he had something that he wanted to show me. I didn't know what it was. And this was 4 or 5 days after I had major surgery on this pinky finger. I had what they called Dupuytren's contracture. And it was bent like this, and you couldn't straighten it with pliers, and then I went and had it straightened. But I had 19 stitches put in this, 5 days, I guess, before I go see Jim. And he's going to show me something. And this finger was totally numb. I had 19 stitches. It was totally numb, and I couldn't wiggle it. So I had a big old boxing glove, kind of a pad on there. I go to Jim's office, don't know what it is I'm going to see. And he showed me the Beamer pad and told me about it. He said, you lie on it for 8 minutes, and it's electromagnetic pulse therapy. I'm laying there, and 4 minutes into the session, I'm sort of scratching my finger, tip of my finger with my thumb, and I can feel that. I couldn't feel it 5 minutes when I walked in. And I thought, boy, this is weird. And then I start feeling my whole finger scratching it, and my feeling was there, and it had been totally numb, just like I'm scratching your finger. I couldn't feel me scratching your finger. Well, I couldn't feel that. And then I started wiggling it. I couldn't do that 5 minutes before I walked in the door. And I thought, this is strange. And so anyway, I didn't say anything until after it was over, the 8-minute session. And I got off of the pad, and Jim said, well, do you feel anything different? I mean, how do you feel? I said, well, I feel fine, but one thing I do notice is I've got feeling in this finger that I didn't have for the last 5 days. When I walked in the door, there was no feeling. And so that's how I got involved. I got more interested. I talked to Jim more about it, and the rest is history. What I've come to learn over the last week or so is that the Beamer that we've been talking about and that I'm excited about was endorsed. I found out last week that it has been endorsed by the NFL Players Association and Alumni, which is a very tough endorsement to get from the NFL players. And so we're excited to be able to go and approach some of my old teammates, which I did last weekend in New York, and I got quite a bit of excitement from them about the prospects of the Beamer, because those old guys, they have a hard time getting around. As many collisions as they've had down through the years, they've got bad knees, they've got bad shoulders, and they've got issues that they have to deal with. And so lucky for me, they had never heard of a Beamer. So now I'm doing some back and forth with them, and they're starting to really ask some good questions now. And I'm anxious to see how that, once they apply this technique to their issues, what kind of reports I get back.
My name is Gary Skeen. I'm from Knoxville, Tennessee, and I've been on Beamer since about a year and a month. I've noticed better sleep, a deep sleep at night. We both use it. My wife has had huge results. All my animals have had huge results. One day, one of my dogs, I have 3 Shih Tzus, and one of them went outside and came back limping, and I'm thinking, first thoughts in my mind is, I'm gonna have to put Freckles, my Shih Tzu, on a vet call to $100 charge. I'm thinking, oh my goodness, I'm gonna have to go to the vet, pay $100 and do that. So I thought, why not put him on the Beamer? So I put him on the Beamer, 1 session, 8 minutes. He never limped again. When I first got on the Beamer and first tried it out, I actually didn't feel anything when I got on it. laid on it, didn't feel a thing. I felt great when I got on, felt great when I got off, but I knew it was doing something to my system. I knew it opened my blood vessels up at least 30%. And so the next day, it's in July when I bought the Beamer last year, and I was actually going to have to mow the grass. It takes me 2 hours and a half to mow, push mow, you know. And it's a July day, hot, and I get out there on that mower, pushing it, and I mowed the grass in an hour and 10 minutes, no breaks, and I'm like, oh my gosh, are you kidding me? And so I didn't have a Beamer at that moment, but I went out and bought one just shortly after that from Circulation Station. If you need energy, I would recommend getting a Beamer. I would recommend it because it gives me more energy throughout the day, every day. I would highly recommend going to Circulation Station and getting on the Beamer and have energy all day long. It doesn't matter if you got any physical issues, come and get on the Beamer. It'll change your life forever because life is in the blood.
I'm Janet Hudson, and I initially came into Circulation Station because I have a few medical issues that I've been dealing with for long term. One of them is back issues. I'm a nurse. I guess every nurse has back issues at one time or another. So I also have an issue with neuropathy, and I wanted to see if changing my microcirculation would help those issues. I was very interested in the technology once Jim told me about it. So the really neat thing about this location is you can come in and have 3 tries free to see how it works. And the thing I noticed immediately was I felt really relaxed that first session. I just felt like everything was kind of loose and just relaxed. So I did the 3 sessions, and my husband came also, and my mother. And my mom has a lot of lower leg circulation issues. She's 80. And I thought maybe this would be something really good for her. So we went ahead and actually purchased the ability to use it for a month so that we could see over a month's time what the differences were. I definitely can feel different in my back and my legs when they're really bothering me when I use the system. But the most noticeable thing for me was I went on a hike, and I haven't been on a hike and that strenuous of a hike in I don't know how long. It was 4 miles pretty much straight up and 4 miles down. So most of my hikes are like, little vertical changes. So I thought, I'm going to be dying the next day. So I went home and I used the Beamer. I did a longer session in my hips and my lower legs where I thought I would hurt the worst, and my knees, which were bothering me at the time. And the next morning I was just a little sore, hardly sore at all, which I thought was very unusual for me because anytime I start exercising, things are like over-exaggerated in their soreness. So the next morning it wasn't bad. I did it again in the afternoon. The next day I woke up and I had no soreness at all. So I was very pleased with those results. So I would recommend this to anybody who's having any kind of chronic pain or even acute pain. It's worth a try to see if it makes a difference in your life. So I would just really recommend it to anybody. I can definitely tell nurses that they probably should come give it a try because we're always, lifting and pulling and tugging on really large patients, and over time the stress on your body just starts to break things down. So it's a really neat tool and part of your health.
The reason that I'm here is that I met Jim through a request on his part for me to coach his daughter in the pole vaulting. And so that connection has brought us together. And so in that connection, I've expressed some difficulties with different aspects of my body from having to stand on concrete all day long doing the job that I'm doing. And so that brought up the subject of the Beamer, and with that introduction, he invited me to come over and give it a try, and since I've given it a try, I've seen dramatic changes in my physiology and my ability to perform those duties. So the older you get, the less your body can recover from the things that you used to do fairly easily. And if I stand on concrete for 6 to 8 hours a day, it feels like my feet get rounded on the bottom. And in a sense, they actually do, because that's swelling. And so I expressed that to Jim, and he said, well, come over. So we did a few treatments, actually just last week on that. And the swelling is completely gone. So from that point of view, it's kind of a lifesaver for me, because I can do things now that I wasn't able to do a month ago. I've coached both high school athletes and collegiate athletes and post-collegiate athletes. And the biggest demand is on the collegiate athletes, because they're student athletes, so the studies come first. The demand on most students in a collegiate environment, and especially in the first year, are pretty dramatic. I mean, for them to be able to come and take advantage of this technology and at least have that recovery be nearly instantaneous, their ability to perform in the academic environment is increased, the ability to perform in their practice environment, which is crucial to their growth, is increased. And so overall, it's just it's a piece that has been missing clearly from our ability to take these athletes to higher levels, in my case, literally. I would recommend Circulation Station to the beginning athlete and probably their parents, because their parents are now reaching an age where they're going to need all kinds of recovery from just growing older. So the beginning athlete, the high school athlete, the collegiate athlete, because of all the points that I mentioned. But anybody who's struggling with repetitious kinds of stresses on their body on a daily basis, anybody in that environment, whether it's physiological or even emotional, and the psychological aspects of it also put a stress and physical demand on your body. So anyone in that kind of a situation, and people growing older who just simply need as much help as they can get, would really benefit from this technology.
My name is Jane Knight, and I first came to Circulation Station because of pain in my back and my knees. And so when I met Jim, he explained the process, and I thought it might be something that would help. The first treatment, I was a little surprised the pain went away for 12 hours, which was great, not to have pain for 12 hours. The second treatment was a little bit less. The pain was gone a little lesser time, but I did notice that last week when I was here for my third visit, the pain again was gone for just about 12 hours, maybe a little bit more. I have tried many other types of treatments to get rid of the back pain, to get rid of the knee pain. I came to the Circulation Station after talking with Jim because he explained to me that it was a more natural way. And the thing I liked about this, and I am going to continue to do this because I think this is something that will help me to help my back without being, without taking some sort of medicines or adding some chemicals to my diet or anything like that. I like that it was non-invasive, and I like that it was a more natural approach, because I've tried to seek out many holistic methods before I came to the Circulation Station, and they didn't work. And I spent a lot of money trying to get that relief for my back but sometimes you don't know it's going to work unless you try it. So this is something that I plan to continue, and I would definitely recommend if you have something, like back discomfort or knee discomfort or shoulder, whatever, try this, because I think it's probably a good way for you to get relief without having to do any injections or anything like that.
My name is Ed Smith. My first experience was in February of this year. Jim and I were in a study together, and I mentioned that I was having distress in my legs. So he gave me a big smile and suggested that I come down to a place called Circulation Station. And I did, and he said, try it for a week. And I did, and I would leave, there wasn't anything real dramatic, but there was something. Of course, in a week, you're not going to really, it's nothing, there's no, there's not going to be a bolt of lightning, but there was something. So I signed up for another month, and during that month, it was positive. And again, it's hard to quantify, except it made me feel better. And so after the month, I decided to buy one of the systems. And so I have been using it morning and night since then. And the best way that I could explain it is my parts work better. September of last year, I was diagnosed with multiple myeloma, which is a bone marrow disease. I went into remission again very quickly. I went into remission in about 5 months. Being a blood disease, again, I don't think it's a coincidence that my progression was as quickly as it was. I think the BEMER system has been a big plus there, just because of the quick recovery or the quick remission there, and then on my back surgery. So I would recommend utilizing the Alcoa location of Circulation Station, because Jim's a good guy. There's no pressure, and the product is good. And again, as I shared earlier, I thought enough of it that I bought one, and I use it twice a day. And again, my parts work better after using it.
Hello, my name is Susan Beauchamp, and I've been in education for a number of years and recently retired. And of course, being in education, you always have a lot of great stories and things that happen. But as an educator and dealing with educators over a number of years, like athletes, we have a lot of issues where you're in a grueling situation, standing on your feet all day, a lot of bending, a lot of moving, and as a result of being in as long as I have, I've incurred some joint situations and some issues. And it's pretty ironic because several months ago, I was at a pro celebrity golf tournament in Atlanta, Georgia, and that's when I had the pleasure and the honor of meeting a gentleman by the name of Jim Vesper. Anyway, I saw a table and we started talking, and the information he was giving me was quite elaborate, but kind of sunk into my brain that day that there's something about this that is really great. So the next thing I knew, I'm lying on a table and I'm having, I don't know what you would call, because I don't know the technical term, seemed like electrodes, because whatever this BEMER was and lying on a pad, the electromagnetic field was supposed to help with possible aches, joints, and most of all, blood circulation. As a former science teacher, I understand the circulatory system. And I remember lying on the table and listening to the guys talking and conversing. And then when we were all through, I got up and I went, wait a minute, I don't have this pain in my neck. And believe me, I've had a lot of pain in my necks over the years, but this part behind my neck was something that I'd even gone to a chiropractor, and he said, you had an injury once. And I thought, geez, I've only done this one time. This is pretty terrific. So as a result, we went back to the table, and I told him that several years ago when I was in school, I had an incident where my thumbs were severely injured. I have to have cortisone shots every 3 months. I've developed osteoarthritis. And I'm telling you right now, for being the healthy person I am, and I feel that I'm physically in good shape, this is probably one of the most painful things I've ever experienced. It was so bad, I can't even unscrew a jar, unscrew a bottle, or anything. So, mentioning this to Jim, he says, well, let's wrap some of these around you. So I laid on the table for my neck, and I also had the wrap around my thumbs. And I don't remember exactly the amount of minutes, but following the time span, I got up and I went, oh my goodness, this is something else. These thumbs, they're working. Now, demonstration, always have to bring a prop. Normally, I cannot do this. And you know how tight these things are. Voila. This is a result of something that is so unbelievable and so unique. I feel like I've got to spread the word and let others know about it. And the one thing I do know from all the years that I was a science teacher is if the circulation of blood is flowing throughout the body, to your brain, to your limbs, it can do nothing but improve your well-being and your lifestyle. So I'm really thrilled to know about the BEMER, and being at the circulation station is an honor to me. And I hope that I can spread this on to some other friends of mine so they can benefit from this life-changing experience.
My name is Rick Rosenbaum from Knoxville, Tennessee, and I've come into looking at the BEMER therapy at the circulation station about 6 months ago when a friend of mine came up to me and talked to me about it, that he had discovered it, because basically being a diabetic of 18 years, I had a chronic open wound sore for about year and a half, 2 years. And my friend came up to me and said, I found an alternate therapy that can really help you. Now the doctor, my foot doctor, was a great doctor, and for 18 months, for a year and a half, he and the hospital tried their best to work on this ulcer, this open sore. And I always had that hanging over my head from the very beginning, is that if this doesn't close, you're probably looking at amputation. So that's where I was at the point where when this friend came and told me about BEMER therapy at the circulation station. And so I went knowing that my skepticism would either be denied or not shown true or true just by seeing what it did to my body. And I have seen over the 6 months, and especially recently, sometimes it's hard when you look at something every day to see a change, but I've seen a change in the foot wound, especially where the depth is less. It's been coming up. And that's what it basically needs, is to come up to the surface to be healed. So I'm really encouraged by that, because the other option was just the amputation. And now I really have hope, I think, that this is going to happen eventually. But in the meantime, with all of that going on, I started to notice other things were improving. So I ended up writing up a list. I've had to increase and increase, but it's like a list of now 42 different things that have been a problem. And then I'll check them off when they're taken care of. And so I'm still in the process. Some are small, medium, and of course the largest one is the foot one that I'm still looking at. But out of these 42 things, after 6 months, I've had about 16 things that have been resolved. In general, I've just found that it's been a real blessing for me, and it's given me a lot of hope. Everybody needs to have good circulation. And if you can increase your circulation, in fact, that's the thing I found out from the doctor, that what he was trying to do for those whole 18 months was to increase the circulation to my wound. And I don't believe they know how to do that. And because the last couple of times when he's looked at it, he just sits back and kind of raises his eyes like he's surprised there's blood in that area at all. So that's exciting, just the fact that I found something that can help me that way.
My name is Rob Youngblood. I actually started using the BEMER back in, I believe it was December or January. But prior to that, I went to go see my doctor, and my doctor said my blood pressure was at 190 over 110. So the following month, without him putting me on the meds, he wanted to double check it, and it still was at that same level. All right. So he put me on 20 milligrams of some heart medication. I can't even pronounce it, right? But make long story short, shortly after I started using the BEMER, all right, I noticed that I was getting a lot more energy. I wasn't fatigued. And within 2 months, my doctor said that my blood pressure dropped from 190 over 110 down to 117 over 73. And it stayed that way. And then eventually I made myself get off the heart meds because I didn't like taking pills, all right? It stayed that way. And even to today, it still runs right around 120 over 80 on average. So yeah, and there's also all kinds of little wow factors that are going on. Fingernails are growing faster. The dry skin is gone. Okay. I've also noticed that I can run a lot better, and I'm not athletic, and I'm 53 years old. Like I said, I recommend it for anybody.